Good evening, everyone. Please confirm if I'm audible and visible. Yes, yes. A very good evening to all. I'm Dr. Jazeer, your dermatology faculty at PW MedEd. And today I am here with a very, very important topic, that is leprosy, must knows. And must knows not about the entire topic, but about the clinical classification. So all of you must have prepared leprosy for any of the exams, be it FMG, NEET PG or INI-SET. In all the exams, this topic, leprosy, is going to be a very important one. And almost always a question is asked. One area where most of you may get confused regarding leprosy is in its classification. And as you know, whenever you have learned leprosy, not just in derma, probably you have learned this in community medicine or any other subject, but where you have learned about different types of classification. There are classifications that splits leprosy into a spectrum of disease. Sometimes there is a classification that is used exclusively for the purpose of treatment, isn't it? So we'll discuss about all of those today, and along with that we'll also just try to see some of the MCQs from the topic as well. So very good evening, Ronak. Thank you so much for confirming as well. So let's move to the first slide of the day. So here we are going to talk about the introduction part. So in the introduction, let's start with some basics. I'm sure that these kind of basics all of you would be knowing, like the causative organism for this disease, which is also called as the Hansen disease, isn't it? So this is also called as the Hansen disease, and the causative organism, as all of you know, this is going to be Mycobacterium leprae. It's going to be Mycobacterium leprae. So in this disease called leprosy, what happens is, what are the sites that is going to be commonly involved? So the sites, as all of you know, again, it is most commonly the patient would come to you with a complaint that there is a hypopigmented patch or a depigmented patch or a erythematous lesion over the skin. So along with the skin, most of the times what happens, there is a nerve involvement as well, which usually comes with a nerve disability, isn't it? Or nerve weakness, isn't it? So all these things can be seen. Now, the incubation period of this disease is interesting because when you learn different diseases, you will see that the incubation period is few days, few weeks and all. But in leprosy, it is a long incubation period. It usually can range between 5 years to maximum 20 years as well. It has a very long incubation period as well. So that is about some of the basics in leprosy. So now let's see what happens in the immunopathogenesis, especially on this context. कि आज हम क्या डिस्कस कर रहे हैं? आज हम यही डिस्कस कर रहे हैं कि लेप्रेसी को हम कैसे क्लासिफाई करेंगे, और दिस क्लासिफिकेशन के लिए इज इट समथिंग रिलेटेड विद द इम्यूनोपैथोजेनेसिस? Yes. What is the most important factor that you should remember regarding the immunopathogenesis in leprosy, especially for the classification, is the CMI. What is CMI? It is the cell mediated immunity. It is called as the cell mediated immunity. So basically the idea here is we will be dividing leprosy into various types, but in all those cases the primary role is in the cell mediated immunity. Matlab, if the cell mediated immunity is very strong, it is very strong, then the patient would end up in a tuberculoid form, a TT type of leprosy. Whereas अभी opposite scenario क्या होगा? Opposite scenario मतलब cell mediated immunity is very weak. If the cell mediated immunity is very weak, then the patient can end up in a lepromatous type of leprosy. So simple, there are two different spectrums of the disease. एक end of the spectrum जो है tuberculoid type, दूसरे end of spectrum जो है lepromatous type. अगर patient का cell mediated immunity is very good, so very strong, the patient can be having a tuberculoid type of leprosy. Whereas if the patient is having a weak immunity, उस time पे the patient would end up in a lepromatous type of leprosy. That is one simple form. Now, what if the patient is having intermediate responses or intermediate type of an immunity? So, in the cases of intermediate immunity, the patient can end up in borderline forms. The patient can end up in borderline forms. जैसे borderline tuberculoid, borderline lepromatous. So in all those cases, the patient can end up in borderline form. So this is the basis when it comes to the immunopathogenesis for leprosy, okay, especially for leprosy classification. अब देखते हैं कि किस टाइप का classifications है, isn't it? Abhi, the most commonly or the most widely used classification for leprosy, this is called by a name. Anyone, any idea? Whoever is listening to this lecture, do you know the name of the leprosy classification that is the most widely used? Anyone? I'm just giving you a chance to answer in the chat box, in the comment box below. The most common classification, this is called as Ridley-Joplin classification. Here it is called as the Ridley-Joplin classification. So what do we do in a Ridley-Joplin classification is we are going to divide leprosy into a spectrum of disease. ये spectrum कहाँ से शुरू होता है? The spectrum begins in TT type, मतलब tuberculoid type of leprosy. फिर the patient can be borderline tuberculoid, that is BT type of leprosy. फिर हो गया BB type, that is borderline type of leprosy. And then the patient shift into lepromatous spectrum, जैसे borderline lepromatous, and towards the end the patient will be in lepromatous type of leprosy. So this is the broad classification of Ridley-Joplin. आज के जो discussion में we'll be talking about each and every type कि patient will present to you with what features and how do you identify BT है या फिर BT या फिर BB. All those things we'll try to understand today. Very good, Said Usman. It's called as a Ridley-Joplin classification. I completely agree with you. Excellent. Now, this is one type of classification. So this is just one type. Now, what is the second type of classification? The second classification, any idea? जैसे leprosy treatment के लिए we are not dividing patient as TT, BT, BB, BL, LL. Treatment के लिए we are going to have another classification, and that is, anyone in the chat box, if you know, just let me know in the chat box. ठीक है? तो जो treatment के लिए जो classification that we are using is the WHO classification for treatment. WHO classification for the treatment. अभी WHO classification में we are dividing leprosy only into two types. Now, what are those two types? It is called as paucibacillary and multibacillary. Paucibacillary and multibacillary. This is what we use for the WHO classification only for the purpose of treatment. So clinical classification के लिए हम क्या use कर रहे हैं? Clinical classification के लिए we depend on Ridley-Joplin classification. But in any of these cases, for the treatment part, we use a WHO classification which divides leprosy into paucibacillary and multibacillary. In India, I'll just add one more classification for your reference. This third classification is called as the NLEP classification. This is specific in India, okay? This is specific in India. That is the National Leprosy Eradication Program. So this classification, again, this is a classification for the purpose of treatment. तो ट्रीटमेंट के लिए फिर से NLEP भी डिवाइड कर रहे हैं, सेम थिंग एज पॉसिबैसिलरी और मल्टीबैसिलरी, द सेम थिंग, बट देयर इज सम डिफरेंसेस व्हिच वी विल टॉक इन द अपकमिंग स्लाइड्स. ठीक है? So basically in today's discussion what we are going to do is we are going to talk about the leprosy classification जो हो गया Ridley-Joplin. The second one is WHO classification. Third one is NLEP classification, which is used for the purpose of treatment. So now let's start with different clinical types. Now the first type that we will discuss today, this is called as the indeterminate type of leprosy. But in this indeterminate type of leprosy, this is not included in Ridley-Joplin classification. So in this type, this is not included in the Ridley-Joplin classification. Now what happens here is, just imagine that you are getting a patient who is a child with hypopigmented lesion over the face. Now this is a typical clinical scenario. You have a child who has come to you, let's say 7-year-old child coming to you with a hypopigmentation over the face. Now you can see something like this. Now if you see, this child is having a hypopigmented patch lesion in the face, then what can be the differential diagnosis here? Anybody in the chat box? इसका differential diagnosis क्या हो सकता है? It's a child, 5-year-old, and the child says यहाँ पे face में there is a hypopigmented patch. So here, so please remember here, the differential diagnosis here is, one moment. So here, the differential diagnosis here can be two diseases. One is pityriasis alba. And the second one is going to be indeterminate leprosy. So it can be either a pityriasis alba or it can be an indeterminate leprosy. So these are the differential diagnosis. Okay. Now, how do you know कि ये leprosy हो सकता है या फिर pityriasis alba? Remember, pityriasis alba is considered to be a type of atopy, like an eczema, like an allergy. And pityriasis, the meaning of the word itself is scaling. जैसे इस patient में, if you can see, scaling is seen, then you can think about pityriasis alba. Obviously, leprosy में क्या होगा? Scaling is absent. It is not seen. Okay? The second difference is, in which patient are you going to consider कि कुछ type की sensory deficit हो सकता है. जैसे the child does not know that you're touching the skin. The child is unable to differentiate between hot and cold. Hot and cold indifferentiation. Right? So in this case, what do you suspect? Pityriasis alba हो सकता है या फिर leprosy? Obviously leprosy, right? Sensory deficit. So here, sensory deficit is always seen with pityriasis, is always seen with indeterminate leprosy. It is always seen with indeterminate leprosy. Now let's see what happens in the cases of pityriasis alba. In pityriasis alba कोई sensory deficit नहीं होगा, तो इसीलिए यहाँ पे sensation is intact. Sensation will be normal or it will be intact. So that is about indeterminate leprosy. I hope I'm clear. So the first clinical scenario जो हमने आज बात किया है, it is going to be a child who is coming to you and the child is having a hypopigmented patch in the face. Now when you see a hypopigmented patch, there are always two differential diagnoses clinically. Pityriasis alba versus indeterminate leprosy. अगर आपको scaling दिख रहा है, then it is going to be pityriasis alba. If there is no scaling, more likely to be leprosy. Whereas sensory deficit अगर present है, then it should be indeterminate leprosy. But if the sensation is normal or intact, then it can be pityriasis alba. So this is going to be the first type of leprosy, what we can commonly see in the OPD. ये तो काफी common है. Not in leprosy, but pityriasis alba is a very, very common clinical condition. Okay? So that is one. So now going to the next one. This is called as the tuberculoid type. So what happens? So what happens in a tuberculoid type of leprosy? In a tuberculoid type of leprosy, Here, the patient would be coming to you again with the same complaint. The complaint of the patient here would be that there would be around 1 to 3 hypopigmented lesions. There would be around 1 to 3 hypopigmented lesions. And these hypopigmented lesions definitely would be having a sensory deficit. Along with sensory deficit can be seen. Along with sensory deficit can be seen. Now, in this case, where a patient is having 1 to 3 hypopigmented lesion along with sensory deficit, for the exam purpose, how do you compare the lesions of tuberculoid type of leprosy? ये काफी important है. Tuberculoid type of leprosy has been compared as a saucer right way up appearance. So you all of you know what is a cup and a saucer. You know, cup and saucer, for which we use a cup of tea, isn't it? Cup and saucer. So this one, the saucer, if it is having a right way up appearance, it is going to be most probably tuberculoid type of leprosy. Okay, it is going to be a tuberculoid type of leprosy. In most of the cases, tuberculoid type of leprosy में क्या होगा? The patient just got leprosy. यहाँ पे द पेशेंट्स सेल मीडिएटेड इम्यूनिटी क्या होना चाहिए, स्ट्रॉन्गेस्ट या वीकेस्ट? जो मेरा फर्स्ट स्लाइड था उसमें मैंने बताया था, isn't it? Cell mediated immunity, if it is going to be the strongest, the patient may end up in tuberculoid type of leprosy. So here the cell mediated immunity is going to be the strongest. Since it is going to be the strongest, if you do a smear, like the skin slit smear, if it is done, here what happens, there will be no bacteria. You cannot find mycobacterium leprae in a skin slit smear because the patient is just getting the symptoms now. The bacterial load is yet to be increased, right? At the same time, what happens with a lepromin test is also very important here. लेप्रोमिन टेस्ट में क्या होगा कि व्हाट डू यू मीन बाय लेप्रोमिन टेस्ट? आप सबने सुना होगा मैंटूस टेस्ट, राइट? मैंटूस टेस्ट कहाँ पे करते हैं? इन विच डिजीज? वी डू इट इन tuberculosis, right? Similarly, in leprosy, we are going to inject a bacteria into the skin. Now, what is being expected here? When you inject a bacteria, if the body is able to respond to it, मतलब immunity अच्छा होना चाहिए. If the body is not able to respond, it automatically means that the patient's immunity is very weak, right? So when you're going to inject a bacteria into the skin, if the body would respond very strongly, that is called as a strongly positive lepromin test. So lepromin test is going to be positive in all the cases of tuberculoid leprosy. And why? The reason is because the patient is having the best type of a cell-mediated immunity in tuberculoid type of leprosy. Clear? That is about tuberculoid type. Now, after tuberculoid in Ridley-Joplin classification, what is the next type? The next type after tuberculoid is going to be the borderline tuberculoid type, right? So let's see what happens in a borderline tuberculoid type of leprosy. Very typical है. NEET PG में there was a question on borderline tuberculoid. There was a question in FMGE exam regarding borderline tuberculoid. Let's see what happens here in borderline tuberculoid. As the patient goes from TT type to BT type, then what happens? The number of lesions, it will increase. They say the patient will be having around 3 to 10 lesions. Now, number of lesions are increasing. The second and the most important point here is you can see two type of lesion here. एक हो गया satellite lesions. So if there is a mention कि अगर कोई भी MCQ which will mention that patient presented with 5 hypopigmented patches in the skin along with sensory deficit. Sensory deficit के साथ if you can find satellite lesions or another lesion which is called as pseudopodia. This is typically seen in borderline tuberculoid type of leprosy. Now, what is the satellite lesion? I'll just zoom this image. Now, this is the actual lesion of leprosy here. Just outside the main lesion, if you are able to see some smaller lesions outside, ये जो small lesions which is corresponding to the main lesion, this is called as a satellite lesion, and these satellite lesions are typically seen in which type of leprosy? Borderline tuberculoid type of leprosy. In some of these patients, क्या होगा कि I better draw this for you to understand कि what do you mean by a pseudopodia. Pseudopodia matlab this lesion is going to have an extension like this. So once this lesion is going to have a extension like this, it is called as a finger-like projections. This is called as pseudopodia. If podia finger, so pseudopodia finger-like projections which can be seen. Now this is a typical characteristic of borderline tuberculoid type of a leprosy. Now here, just remember, every clinical presentation is different. क्योंकि indeterminate leprosy में it was a child with a lesion in the face. Tuberculoid type of leprosy में the patient had only up to 3 lesions, and 3 lesions were compared to a saucer right way up appearance. Whereas in borderline tuberculoid, the number of lesions were up to 10, and the lesions were having satellite lesions or pseudopodia as well. That is about borderline tuberculoid. Now the next one is mid borderline, which we also call it as borderline borderline. अभी mid borderline या borderline borderline में क्या होता है? This is the most unstable form of leprosy, most unstable as well, and the rarest type as well. Is the most unstable form as well as the rarest type of leprosy. Now in this rarest type of leprosy, what can you see here is the exact opposite to tuberculoid type. ये जो lesions है ना, the moment you see this lesion, this is a very good image based question for your exam, and it's easy to diagnose as well. Reason is, if you find central punched out lesions, if you can find central punched out lesion in the center, you can see that there is a punched out lesion like this. This is very typical for borderline type of leprosy. Borderline. Some textbooks, it is also compared to as, so some of the textbooks, it may compare it as a inverted saucer appearance. It may be compared to a inverted saucer appearance, or it can be compared to inverted saucer appearance or Swiss cheese appearance. Swiss cheese appearance. Okay, so this is how it is being compared. I hope it is clear. Punched out appearance, if you are able to see, answer is BB. Inverted saucer, पहले मैंने बोला था saucer right way up, अभी हो गया inverted saucer appearance, or it is a Swiss cheese appearance. That is how we call it as a mid borderline or borderline type of a leprosy. Is that clear? So now let's go to the next one. Now the next one, that is borderline lepromatous type of leprosy. यहाँ पे क्या होगा? The number of lesions are constantly increasing, right? So when the number of lesions are constantly increasing, so there will be numerous lesions. Okay, there will be so many lesions, numerous lesions will be there, but you can see about the size of the lesion. अभी ये image देखो. So what is happening to the size? पहले क्या हो रहा था? Size इतना बड़ा था, isn't it? इतना बड़ा size था. So in all these cases, the size of the lesion was very big. Now, by the time the patient is going into a borderline lepromatous, the size has become way too small now. So they become very small lesion. And this is the first time when the lesions will start becoming symmetrical. So let us write down as almost symmetrical lesion. So the lesions, they become almost symmetrical by the time the patient moves into a borderline lepromatous type of leprosy. Clear? And the last one in the spectrum of this disease is the lepromatous type of leprosy. Now, in lepromatous type of leprosy, all of you know that the cell mediated immunity is the weakest. Matlab the patient ka immunity has gone to the worst level, right? So in this patient who will be having a very weak immunity, how will the patient present to you with leprosy? First thing is you look into the face of the patient. Abhi face will look something like this. What do you call for these lesions? जैसे आप अभी ये जो screen में देख रहे हो, the image. So in this image, what is a primary skin lesion called as? The primary skin lesion, all these big size lesions, these are nodules, right? So यहाँ पे the first thing is you can see multiple nodules over the face. So you can see multiple nodules over the face, isn't it? There can be a ear lobe thickening. There can be an ear lobe thickening. So these multiple nodules in the face, a thickening of the ear lobe, and all these things together, we call it by a special name. And what is this name? This is called as leonine facies. So this is called as the leonine facies. So leonine facies का मतलब यही है, it looks like a lion-like face. So there is a lion-like face in this case. So that is about lepromatous type of leprosy. But since in this patient, since the cell-mediated immunity is very weak, you'll find lot other symptoms as well. Let's say what happens to the skin. जैसे in trunk क्या होता है कि you can see numerous symmetrical small lesions in the trunk. Here you can see a lot of small hypopigmented lesions in the trunk. So that is what you can see in a lepromatous type of leprosy. Along with that, since this patient is having a very low immunity, there will be lot other symptoms as well. And some of the symptoms which we can write down right now is there can be a hoarseness of voice. There So these patients may lose out on the entire eyebrows. This is called as madarosis. The nose of the patient would have a saddle nose deformity, etc. So these are the different types of presentation that you can see in a lepromatous type of leprosy. These are seen in lepromatous type of leprosy. So whatever we have learned just now, to do a very quick revision, we started with a indeterminate type of leprosy जहाँ पे the patient is a child और child का presentation क्या है? The presentation is a hypopigmented patch over the face. Now, when the patient is having a tuberculoid type of leprosy, patient is only having around 1 or 3 lesions in the body. And these 1 to 3 lesions are large lesion and it has an appearance like a saucer right way up. When the patient moves into borderline tuberculoid, up to 10 lesions will be there, isn't it? But you can see some small lesions outside the main lesion, which is called as a satellite lesion or a pseudopodia, when there is a finger-like projections can be seen. When the patient moves to a mid-borderline type, यहाँ पे क्या होगा? There will be large lesions, but the center will be having a punched out appearance. Punched out appearance of the lesion in the central part. या फिर the patients, these lesions can be compared to an inverted saucer or a Swiss cheese appearance. All these things in the MCQ, think about mid-borderline type of leprosy. Borderline lepromatous less likely for your exam because it doesn't have too many typical characteristics. But remember, number of lesions will be so many. Numerous lesions can be seen. But what about the size? The size becomes very small. And not just that, the lesions almost start becoming symmetrical by the time the patient is in a borderline lepromatous type of leprosy. And finally, when the patient goes into a lepromatous type of leprosy, then what happens? From the face itself, you will be able to diagnose. क्योंकि face में क्या होगा? Multiple nodular lesions होंगे. Along with nodular lesions over the trunk, the patient will be having a multiple numerous small hypopigmented lesions in the trunk, और काफी ज्यादा दूसरे symptoms भी होंगे, जैसे there can be a saddle nose deformity, there can be a hoarseness of the voice, madarosis can be seen, and many others also. Okay, and what is the name of the face? The face is called as a leonine facies. It's called as a leonine facies. So now, just summing up whatever we have learned. So we have already learned that TT, BT, BB, BL, LL. So these are the 5 types in the Ridley-Joplin classification. And सबसे best immunity होगा in tuberculoid type. Worst immunity होगा in the lepromatous type of leprosy. And few lesions will be there when it comes to tuberculoid type. There will be numerous lesions when it comes to lepromatous type. Now, if you do a simple test which is called as the skin slit smear, you're going to give a slit behind the skin and you're going to examine under a microscope कि सबसे ज़्यादा bacterial load कहाँ पे होगा? Maximum bacterial load will be seen in lepromatous type of leprosy. And where will you find minimal bacterial load? Minimal मतलब negative कहाँ पे होगा? Most commonly, negative will be seen in tuberculoid type. In BT type also it may be negative, can be positive as well, but negative for sure in tuberculoid type. And मैंने जो बताया था the lepromin test once you do it over the skin, अगर body react कर रहा है इसका मतलब ये है कि immunity is good. So you will get a very strong lepromin test in TT type of leprosy and the body will not react क्योंकि यहाँ पे तो immunity है ही नहीं, isn't it? इसीलिए there is no reaction from the body. Lepromin will be negative in lepromatous type of leprosy. I hope it is clear. So that is all about Ridley-Joplin classification. ये जो Ridley-Joplin classification है, why do we do this? क्योंकि हमें clinically differentiate करना पड़ेगा कि the patient can be classified under which type. But when you have diagnosed leprosy, जैसे आपने clinically check किया, the patient is having sensory deficit, कभी कभी nerve disability होगा जैसे wrist drop and all those things, and you must have done a skin slit smear. So bacterial load you must have find out. You must have done a histopathology, isn't it? ये सब करने के बाद आपका diagnosis तो हो गया, पर diagnosis as leprosy करने के बाद how do you treat leprosy is not based on Ridley-Joplin. ठीक है? Ridley-Joplin is not used for the treatment purpose. For the treatment purpose, we use this one, which is called as a WHO classification. So what happens in a WHO classification is we simply divide leprosy into 2 types. First one is paucibacillary, second one is multibacillary. यहाँ पे हम क्या करेंगे? ये जो पेशेंट आया था आपके पास जैसे ट्यूबरकुलॉइड टाइप ऑफ लेप्रेसी या फिर बॉर्डरलाइन लेप्रोमैटस टाइप ऑफ लेप्रेसी, फर्स्ट थिंग यू विल डू इज काउंट द नंबर ऑफ लीशन. नाउ व्हेन यू काउंट द नंबर ऑफ लीशन, इफ इट इज लेस देन or equal to 5 lesions, okay, and when you do a skin slit smear, अगर आपको under the microscope if you don't find any bacteria, that is it is negative, that is called as a paucibacillary type. ठीक है? And what is multibacillary? Multibacillary, अभी आपको paucibacillary पता है, तो multibacillary क्या होना चाहिए? When you count the number of lesions, if the number of lesions is going to be more than 5, and when you do a slit smear, when you can see that there is a bacteria that is present under a microscope, agar SSS is going to be positive, this is called as a multibacillary. Difference बस इतना ही है कि अगर less than 5 lesions है and there is no skin slit smear positivity, then you treat the patient for 6 months. ये जो multi drug therapy होते हैं, so multi-drug therapy is done with 3 drugs, that is dapsone, rifampicin, and clofazimine. So this multi-drug therapy can be given for 6 months if the patient is paucibacillary. Agar patient is going to be multibacillary, then you're going to give the treatment with the same medicines, dapsone, rifampicin, clofazimine, but for a period of 12 months. But for a period of 12 months. So that is basically the difference in WHO classification. Just two types, paucibacillary and multibacillary. So now let's see another classification. जैसे इंडिया में what we do is we use another classification in India which is called as the NLEP classification, National Leprosy Eradication Program classification in India. So what do we do in the cases of NLEP classification is यहाँ पे जो basis है, the basis is just on the number of lesions and the number of nerve that is being involved. Because what we do in the NLEP is that the smear testing, okay, the smear testing is not mandatory in PHC level. ये जो skin slit smear है, the test that we do, and that test is not kept very mandatory in the PHC level. So in the cases of NLEP, you can check for two things. कितने skin lesions है और अगर कोई nerve disability and nerve thickening है. So sometimes let's say the greater auricular nerve gets thickened. वो हो गया nerve thickening. Sometimes there may be a claw hand or a wrist drop. मतलब nerve disability है. So that is also something what we are going to check. So here what we are going to do is again count the lesion. If it is up to 5 lesion, paucibacillary, more than 5, multibacillary. If at least one nerve is involved, okay, so then what happens? It will change. So less than or equal to one nerve is going to be paucibacillary, and if there is more than a nerve that is involved, it is going to be multi type of leprosy. That is about the NLEP classification. So remember that we basically divide clinical classification as Ridley-Joplin and the classification for the purposes of treatment as either go for NLEP or for the WHO classification. So now let's see some of the MCQs from this topic as well. So when you're preparing for your exams, you need to be prepared like a patient is presenting to you with hypopigmented patches with some nerve disability or a or a sensory deficit, and they'll give you some more additional clues as well. Based on that, you need to differentiate कि किस type की leprosy है, isn't it? So now let's see this question. A patient presents with a single well-defined hypopigmented anesthetic plaque on the arms. Smear is negative. Lepromin test is strongly positive. What is the answer? Anyone in the chat box, please? So who knows the answer for this question? Patient is having only one lesion and the skin slit smear is negative. Bacteria का presence नहीं दिख रहा है under the microscope. And lepromin test is strongly positive, which means the patient is having a good immunity as well. So anyone, what is the answer? So here, is it BT, TT, BL, LL? Since there is only one lesion and lepromin is positive and skin smear is going to be negative, the correct answer here should be TT type of leprosy. So now let's do one more question here. Multiple hypopigmented macules over the face. So now here the patient is having over the face, ear lobes are getting thickened, madarosis is present, and the smear is very strongly positive. Now it is not about lepromin test, but the skin slit smear is positive here, and ear lobes are thickened, madarosis is present. All these things are typical features. कहाँ पे है? This can be seen in lepromatous type of leprosy. So moving to the next one, annular plaques with punched out center, variable sensation, few bacilli can be seen on the smear. So where do you find annular? Annular means round colored plaque and there is a punched out center. So as a punched out center, where do you see BT, TT, BB, LL? Yes. So this is a saucer, inverted saucer appearance, or a Swiss cheese appearance, or a central punched out appearance. This can be seen in borderline type of leprosy. So now moving to the next one. What is this? A patient has 3 lesions, no nerve thickening, and smear is negative, which means no nerve is involved. Skin slit smear be negative hai, and overall number of lesions is just 3. So in this case, what should be the right answer? As per NLEP, possibacillary, multibacillary, indeterminate tuberculoid. अब इस MCQ में the easiest thing is you can rule out this and this, क्योंकि NLEP just divides leprosy into 2, possibly या multibacillary, right? So indeterminate and tuberculoid was in Ridley Joplin classification. ये जो NLEP में नहीं दिख रहा है, isn't it? So now what is it? 3 lesion, no nerve thickening, and smear is negative. This is seen in possibacillary leprosy. That is seen in possibacillary leprosy. Next one, in which of the following is lepromin test negative? Lepromin test will be positive if there is some reaction in the skin, and good reaction is seen when there is a good immunity. Whereas lepromin will be negative when there is no reaction in the skin, and that happens when there is a very bad or a worst immunity. In which type do you have the worst immunity? You have worst immunity in lepromatous leprosy. You can see that in lepromatous leprosy. So that is all about the different types of classification in leprosy. I hope the session was informative for all of you. And please remember, once you understand the different types of classification, the way they present, and once you see more images, like based on the characteristics as well as the number and other things, then you'll be able to easily classify it clinically. And when it comes to the treatment part, you just need to go with the type of classification that you would like to go for the treatment, whether it is a WHO classification or the NLEP classification. So that is all about today's session. So if there is any queries, please do let me know in the comment section. Else we will call this a day. I'll take a few seconds for any questions, but if not, then we'll see you next time with more such short topics, but yes, must know, very important topic. Thank you so much.